Good morning to all of you, and thanks for coming. My name is Antonio Godioso. I'm Secretary General of Cittadinanza Attiva, and I'm very proud to be here today with you to have this the first meeting, launch meeting of interest group inside the European Parliament on patients' rights and cross-border health care. First of all, I would like to thanks all people that give us the possibility to be here today, and not only because we are not speaking about a general event, but an important moment that since from the launch of the European Day of Patients' Rights, we are trying to organize. So a place where it was possible an alliance between members of the European Parliament and citizens to discuss and to implement the work on implementation of the European Charter of Patients' Rights, as well as the work on concrete implementation on European Directive on Cross-Border Health. There are several guys that we have to say thank you inside the European Parliament, but let me say thank you in particular to David Borelli, that is with me today, that is not only an important leader inside of the European Parliament, but the guy that since at the beginning decided to invest in terms of empowerment, of the involvement of the members of different groups on the idea that was possible to have a space in the European Parliament to create this kind of alliance. I would like just to say that at the end of the day, as a civil society leaders, we know that daily the people makes the difference. We can speak about the different objectives, the different opportunities and challenges, but at the end of the day, the people makes the difference. That is what we're trying to explain to the European institutions. And with David, we are saying that the people make the difference because we have, I think that 15 years that we have started to discuss about how to create an interest group in the European Parliament. But at the end of the day, the people and the members of the European Parliament that have trusted on this make the difference. So thanks again to David and to all the team and group, and that is supporting actively this initiative, and give the floor to him, and then we will start with Mariano and the works of the day.
Thank you very much. Thank you very much to you all. I'm going to speak in my native language, so Italian. You have a earphone if you want to use it. I think that the channel 2 is the English one, so you can have the translation. Innanzitutto,
I'd like to start by thanking you all for being here today. I'm happy to see so many of you. I'm sorry that the room we chose isn't big enough for you all to fit. We didn't expect quite so many people. But for me, it's a pleasure and an honour to be here. I'm very honoured to be here with you today for the official launch of the InPress group on patients' rights and cross-border care. I think we're setting off together with Cittadinanza Attiva. We started on this path in spring this year, and we hope that this will be able to make an active contribution to reflections on the debate within the European institutions, national institutions and civil society organisations who work in this area. The idea of setting up an interest group started because we wanted to provide continuity and also to provide unity with Cittadinanza Attiva, who are working, fighting this battle. And it's a very important battle. It's one which concerns all of us very closely. Because our rights change often when we are faced with illness. We have to ensure that the civilization that Europe represents can be expressed towards people who are most vulnerable and who are weaker. We can't lower our guard. We have to remain vigilant. during these times of economic crisis and when austerity policies are affecting our welfare model. We have to keep our guard up and also look at the impact of migratory flows, because migrants are often people who are at risk of poverty, and those at risk of poverty are often those whose fundamental rights to healthcare are most affected. Another important issue, but very closely linked, is the right to care in any member state of the European Union. We've created a single market, but we still have to fully implement the full meaning of European citizenship, and abolishing borders in this area is a step forward. In these debates today, we're going to and this is thanks to the number of excellent speakers, to continue along these lines. I will always be in the front line in these battles, and we'll be dealing with all the issues linked to the implementation of the legislation. I wish you all the very best for your work. Thank you very much.
Thanks, David, for your welcome introduction. Also, because usually, sometimes in Italy we have the habits to see the political leaders that coming to the event, say ciao, and then disappears after 3 minutes. And so if you say that you will stay, we are more than happy, so we can measure your interest. Yeah. And since the beginning, yes, done. So thanks again. And I give immediately the floor to Mariano Votta, Director of Active Citizenship Network, for the introduction of the work of the day.
Thanks, Antonio. Good morning, welcome, dear members of the European Parliament, institutions, relevant stakeholders, colleagues, friends. Being here in Brussels today is not a secondary issue to be taken for granted. We perfectly understand those who confirmed their attendance and changed their mind afterwards. This is why I would like to thank you twice for being here, but above all, for having embraced the message coming out from this meeting, which goes behind the initiative we are about to introduce. There is a civil society who does not stop. It's made of professionals, representatives of public institutions, citizens who are not afraid of going on. As I said, we have embraced the protection of citizens' rights, and therefore we simply do not make any exception to this commitment. Rhetoric aside, thank you very much indeed, and congratulations. Well, today we are proud to present an initiative we have been worked on with utmost dedication and joint efforts. We have to thank, first of all, the Italian member of the European Parliament, David Borrelli and Gianni Pittella, and of course, thanks to all the MEPs that have accepted to support the interest group. Civic society, patient organizations, members of the European Parliament work all together to strengthen the protection of patient rights in the European framework. This is the message, the main goal of this initiative. To those who wonder why the launch of this interest group, we may answer why only now. Indeed, the rise of the interest group goes in the exact direction of the latest decision of the European Commission, who has recently introduced the right of cross-border healthcare. And it's absolutely in accordance with more than 10 years of commitment of active citizenship network at the European level, which first led us to the drafting of the European Charter on Patient Rights in 2002. That is over there. And later to the celebration of the European Patient Rights Day, which has become a permanent event in the European agenda since 2007 and has involved tens of civic and patient associations, receiving also the support of several stakeholders and institutions at local, European, national level. Actually, there is a variety of reasons who encouraged us to found the interest group. Patient centricity and health in all policies are two major drivers of actions and progress promoted by European institutions on health issues. We convey these ideas into acknowledgement and respect of patient rights. Patient rights centricity and patients' right in all health policies. Citizens suffering from different diseases have the same rights to be informed, to promptly access to the most appropriate care, to freedom of choice, to avoid unnecessary pain, to innovation in favor of patients. Thus, over the years, we have carry out a lot of activities with the purpose of describing, on the one hand, the level of interest of institutions and stakeholders on the topic, and on the other hand, the level of information and awareness of citizens and patients in relation to their rights. The answer is that we are still far from a satisfactory situation in terms of both formal acceptance and recognition of patients' rights by national and European laws, and effective respect and exercise of these rights. The interest groups aims at drawing and maintaining the highest level of attention on the topic, also because we are pretty sure that strengthened protection of rights all over Europe may contribute to reinforce a sense of belonging to a European citizenship we desperately need to build. At the same time, it's necessary to mobilize all effort to build an enabling environment for citizens and patient organizations in European health policy. In particular, we believe that any action intended to facilitate collaboration and sharing of information or know-how among national associations, European networks, member European parliaments in these cases is definitely an asset. As many of you already know, the idea of encouraging a MAPS intergroups focus on patient rights is connected to a widespread request of 100 or more civic and patient organizations sent to the European Parliament to officially recognize the importance of citizens' initiative in health policy making. The request has been launched last May and is included in an official document voted by the European Parliament, the report of Safer Healthcare in Europe, Improving Patient Safety and Fighting Antimicrobial Resistance. Well, let me say that the interest group aims to be an open space where different topics related to patients' condition can get the appropriate attention of the European institutions and a patient-centered care perspective, with the contribution of all relevant stakeholders. Today is also the first occasion to collect your proposal for the next meetings that will be organized accordingly. Our idea is to promote initiatives focused on each of the 14 patients' rights established in the European Charter on Patient Rights, also taking into account what is scheduled for the next semesters of presidency of the Council of the European Union. Now we are ready to start talking about the new patient right introduced by the cross-border directive, the patient right to go abroad for care. With this directive, for the first time, as you know, the patient rights are mentioned in the title, and so including the European legal context. Moreover, two rights stated in the European Charter, the right to free choice and the right to information, are officially recognized. We believe that the concrete implementation of this directive could testify the real commitment of our governments at national level in the framework of patient rights. For this reason, the implementation of this directive is so relevant for us. So, from our perspective, the main aims of the interest group are to strengthen the protection of patient rights in European legislation, starting from the adoption of those including the European Charter on Patient Rights. That's a milestone of the drafting of other charters. To promote initiatives to encourage and ensure the appropriate implementation and respect of European legislation focused on patient safety and the protection of their rights, starting from the directive on cross-border. To actively support the celebration of the European Patient Rights Day and collaborate with the civic and patient association at the national and European level. Make the European Parliament acknowledge about the European Patient Rights Day in order to officially recognize and institutionalize it, and why not, to establish altogether an European Year of Patient Rights. We believe that the European Parliament has the opportunity to play an active role to improve the protection of patient rights in the European framework, also thanks to the help and effort of this interest group. Thanks again for your support. Last but not least, let me remember that the Secretariat of the interest group is granted by the representative office to the European Union of my organization, that I would like to thank you a lot for the great effort and dedication. Therefore, thanks to my colleagues Bianca, Claudia, and all the ASEAN staff, Danielle, Lisa, and Sonia. I thank you for the attention.
Thanks, Mariano. We have the framework of the discussion that we'll have this morning. We have to to go straight to the discussion, we have divided everything in 2 panels, and with 2 questions for each panelist, so we have the possibility to have concrete feedbacks about some important issues that for us is absolutely key for implementation on directive on cross-border health. So in each panel we have 5 members, 5 different panelists that can representing different stakeholders to have the feedbacks about 2 questions. The first one about the first panel that we're going to. The first panel is patients' rights in cross-border healthcare in European agenda. The first question is, what should be done at the EU level because the transposition process would not only be a problem of a single member states, but a coordinated action supervised by the EU institutions. And second question is, what can we do and propose as a group of different stakeholders for a more effective implementation? I would like to ask to Therese Comodini-Caccia, member of the European Parliament from PPE Group, to take the floor for the first speech.
Thank you. I will have to disappoint you because, like those Italian politicians, I will have to leave. But rest assured that I don't know why your Italian politicians leave, but I am leaving because we have a working group and we're discussing terrorism. And so I will have to be there I was meant to be there 20 minutes ago. I am very happy to be a member of this interest group, and I am very happy to be a member of the interest group because I have been working back home in my country with health organizations on promoting patients' rights and the Patients' Rights Charter, as well as making sure that the implementation of the Cross-Border Health Directive is well implemented and implemented in such a way that empowers patients to make use of it. I think if I had to focus on the cross-border health directive, there are a few challenges, and the main challenges arise because of either incorrect implementation, inadequate implementation, or half-baked implementation. Yes, there is a financial cost to offering the service, but we are MEPs, and therefore we believe that the European Union is there to do benefit to individuals. Otherwise, there's no need for us to be here. If we truly believe that, and that is what the directive represents, then we need to make sure that our member states do put forth the resources necessary to have it implemented fully. I have met a number of patients from my own country, as well as from other member states, who are still complaining about the lack of information on how to make use of the system, how easy it is to access that information, and then very often it is not easily accessible, why their requests are denied, and very often they are not given very specific reasons why their requests are denied, and all the while these patients would have their treatment or their medical intervention postponed. I would say for very bureaucratic reasons. So I think I would have 4 challenges that we need to address as an interest group. First, it's the unequal levels of implementation across member states, which often deter patients from using their cross-border rights in practice, and therefore we need to find measures on ensuring a fair transposition of the cross-border directive. I am sure that we cannot do this without the organizations, the healthcare organizations. Also, because to be able to keep the systems, the member states to account, we need to make sure that our patients are fully empowered. It is our patients who can keep this system to account much more than us as MEPs. As MEPs, we are only one stakeholder in this. But if we need to strongly empower our own patients, who are the ones who are going to be using this system. And to empower patients, then we need the correct information to be given to them, and we need to help them and facilitate the way they access that information. The third challenge is the differences in the quality of information that is available in the different member states. And yes, we do have national contact points, but we seriously have to consider how effective those national contact points are doing their job. I would say that the fourth challenge is to find a way to deliver real, tangible benefits to the patients through greater cooperation and collaboration. We need more cooperation and collaboration between the patients' organizations in the different member states, and this is where I fully agree that we do need a stronger network of patients' organizations across member states, but we need to empower those organizations to hold the states to account. At the end of the day, it is the responsibility of those states to really and truly implement this directive. There is also another stakeholder which we also need to take into consideration, and that is the European Commission. At the end of the day, it is the Commission who is, so to say, the one who will hold member states to account at a European level. We as MEPs can pinch the Commission to do so, to move forward on this. But, and I think the interest group would well consider measures of how to raise more awareness of the incorrect or inadequate implementation of this directive by different member states, so that we could together push the Commission to actually supervise and monitor better the implementation of such a directive. But allow me to conclude that I am glad to be one of the members of this interest group, and I look forward to working with everyone towards creating a better and more effective access to patients' rights as well as to cross-border health services. Thank you.
Thank you very much, also because you going straight to the point of which is the real need to, and why is so important to create a partnership and alliance from different stakeholders. And thanks again for your availability to be part of this process. And I confirm that you are justified if you have to leave for the next meeting. Just to say that now actually are members of the interest group, 20 members of the European Parliament from 9 different countries. And this is important point for sure, like to increase, but also the idea of the group is that it must be like a way, a space and arena to share ideas between, like a network of different stakeholders inside the European institutions. So thanks again for all the members. I give the floor to Pier Nicola Piedicini, member of the European Parliament, member of the ENVI committee, and member of the EFDD group. Mariano before was mentioning that the approval, like a part of a discussion statement some months ago of the work of the European Charter of Patients' Rights and so on. And I have to thank Pier Nicola that has find the idea to put 2 lines in the document, and sometimes also the fantasy to innovate is also to find a way to introduce in the public discussions some important points. So thanks, Pier Nicola, and to you the floor.
Thank you very much. I will speak in Italian if you don't have a problem. Grazie per.
I should like to thank you for having given me the floor. I'm extremely pleased to be here this morning, to have a chance to discuss with these associations that work with patients' rights. We've been working closely with David to try to really push forward these subjects in the areas of our work. I'd also like to thank you for having made reference to the own initiative report that I drafted. I am a physician, doctor, and I was before I became a member of this parliament. So my direct experience, what I saw day in and day out in my job, was that at times there are violations of the patient's rights or things that would impinge on their rights. I saw this directly. So that is what really inspired me to carry out this own initiative report. This was really based in patient safety, patient health, and of course, there was an issue about antimicrobial resistance, which is an extremely important issue and that we're trying to fight. I was so pleased to see that this report was passed unanimously in the ENVI Environment Committee, and then it received large support in plenary as well. There were really two things that underpinned this own initiative report and the right of patients. It's health policy. The first paragraph of the report addressed this issue. Our feeling is that there are a number of different conditions that exist that can have an impact on the upholding of patients' rights, the lack of the respect for that, so they don't have access to care. One of the other major points was that we wanted to be able to try to take health and set it aside from any austerity policies that we're putting into place. We didn't want healthcare to be affected by austerity. We felt that it was something that was of great importance. 3 million cases of negative events take place in Europe where patients are not getting access to the care that they need, and this is a major impingement on their rights. They should be able to go to the hospital, but they shouldn't have to go there and undermine their own health by coming into contact with another illness, by being in the hospital. So we thought that this was extremely important as well. So we thought it was important to try to look into the fact that there is this access. This is effect of coming into contact with other illnesses when one goes to the hospital. There are about 2.7 million cases of that. Then there are not enough people who are working in the healthcare profession. In fact, there are often not enough people, so there is really a shortage of healthcare professionals, doctors, but also those who work in cleaning, for example. What we see is that the healthcare system does not have enough people working in all areas, especially in terms of the cleaning. Lest we forget that there are infections that also are born in hospitals, and they increase regularly over the course of time. So we're trying very much to try to fight for the patients' rights so that they can get correct care. Then there is also something that we are carrying out in terms of one specific drug that is being used to fight depression. So it is used in treating depression as this pharmaceutical product. It was used with adolescents and with children as well. And then progressively what we realized was that through scientific studies, it was shown that perhaps this product was being shown as being effective against depression, but then actually there were negative side effects. Then we saw that the studies were actually completely swayed. So from 0 to 18 years, products were not effective whatsoever in fighting depression, in treating depression, and there were very negative side effects, especially on the children, and they were extremely serious, and sometimes this would even push them to suicide. So we are fighting this product specifically because this is one case, but we see it elsewhere. Because it's true for those who that are 18 years or under, but what happens if they're 19 years of age? Would there be a different effect on the patient just because they are 19? So we're trying to best address the needs of patients and to make sure that they are protected. And so we're really trying to put things back into place in the way that we see best fit. Now, patients' associations need to carry out their role. We hope that they will fulfill this fundamental role. Now, what is that role exactly? It's that we want them to be a part of the decision-making process, and that's why we placed this in the own initiative report. So we made reference to the patient charter and to the other charter in this area. And we know that the current implementation of the directive on health care for cross-border care shows that citizen associations have not been involved enough in the decision-making process as to these documents, or they were only involved on the sidelines. The Commission's report shows clearly that these associations have not been involved enough in the process. And I agree with what was just stated by my colleague. We think that there is one major thing that is lacking, and that there's not enough precise information that is suitable for the patients, and this in the national contact points. There's no reason why a patient who is receiving health care in a country where they do not live will actually get repaid for that, reimbursed for that care, or that their prescriptions would be filled. And there's no actual insurance that they will have access to the pharmaceutical products that they need in another country. And that is one of the main issues that we are working on in this group that David contributed to setting up. These are urgent issues. We need to make sure that the patients are getting the exact care that they need in the best way possible. Thank you for your attention.
Thanks to Pier Nicola Pedicini, also to have underlined this important point related to how key is the empowerment of the citizens and the empowerment of the patients. I would like to just remember that when we are speaking about the future of the patients' rights inside Europe, we are not speaking only in principle about the right to move from country to country, but also about the rights inside the same country. Because the paradox is that, in theory, sometimes it's easier to go to another state to get the treatment more than to be treated as well as in his own state. And for example, I was just remember while Pier Nicola was speaking about, also because your experience is in south of Italy, so that is one of the paradoxes. And also for this is so important to work together, because it's a flag about how we'd like to have in terms of rights, not only throughout the Europe, but also in each country. So thanks again for your contribution. And now is the time to hear Annika Nowak, member of the cabinet of the Commissioner for Health and Food Safety. It is very important, the contribution, also because we are speaking about another key stakeholder, that is the Commission, and we know that the Commissioner is working so much on this issue. So thanks again to be here with us today.
Yes, hello, good morning. And thanks for inviting me. It's a great pleasure. I have been working for many, many years now on this directive, during negotiations and then the transposition time. And now I still have the opportunity to overlook things from the political level. Let me just briefly highlight what the Commission has done, is doing, will do, to ensure the equal, it's a long process, to ensure that we have one day, completely and correctly transpose the directive in all member states, so that all patients can benefit from their rights. And as you said, it's not just, we always have seen, it's not just the impact it has when you go cross-border, but with having contact points in all member states, it creates more transparency in all states, and it should then enable patients, empower patients to also to uptake the rights they have in their own country, to know what healthcare is reimbursed, how do I get access, what are the procedures also in my own country. Recognizing that this directive is a first major piece in healthcare, and it's a very complex one, we decided in the Commission to assist member states during the transposition process, which was kind of also pushing them already. So what we did, we traveled around, we met all the colleagues in the Ministry of Health to discuss each of the provisions in the directive and to see what are the options. Given that there are different healthcare systems, what is the best way to transpose it into their rights? And in most member states, we were also able to attend, or to organize and to attend stakeholder events where we then spread the news. This directive is now adopted, it's being transposed in your country, make sure that you're involved in the transposition process. And in addition, in Brussels, we organized also these kind of transposition workshops with member states to trigger the discussions also between them, not just us as Commission telling them what they should do, but also to find the best solutions to transpose this piece of legislation. This has allowed us at a very early stage to identify what are the challenges in the member states, specific to the health systems, but what is common. And this had also then allowed us now, during the still ongoing compliance check, to look even deeper. Okay, we knew this was coming, so prioritization system is complex, so we knew that is one of the major cornerstone or obstacles in compliance. So still, despite this work during the transposition time, we had to launch infringement cases. So 3 months after the end of transposition line, we launched infringement cases for late and incomplete transposition. I have to make the point because there are two procedures. It's the completeness check, which we done first, and then the compliance check, which is still ongoing. And we had to launch against 26 member states. Yes. So many member states were taken by surprise that we were serious about. We told them several times, this will come, it's an obligation, we have the tool under the EU treaty, and we will use it. And by personal experience, I can say it is, with this legal pressure, it has clearly accelerated the process. In member states who were still discussing transposition law, and also to complete, because sometimes they were unaware what kind of measures they should notify to cover all the provisions. So this was the main task in 2014-2015. By now we have closed almost all cases, and now we have the full, almost full transposition across the EU, plus all member states have established national contact points. Now we have started and we need to address a different question, has it been properly transposed? And you've seen the first report, so despite the major, the obvious benefits for patients stemming from this directive, the implementation level shows a rather mixed result across the EU. First of the key findings was that only small numbers of patients have used the directive so far. Also with regard to, in particular with regard to planned healthcare, so requiring a prioritization. So either it was refused, or in some cases patients just paid it themselves. But the major reason, already mentioned, is the lack of awareness of the rights across the countries. So clearly member states need to do more to inform patients, in particular through their national contact points. And this was clearly not the case in all member states. In some we learned, that or few member states only had, had no interest, in fact, in doing so. So they established a contact point, but then they didn't inform about, or there was nothing. It was just a website, and they were hoping nobody would find it. So here I see clearly, the role of the Commission in ensuring that the discussion among member states goes on how to improve the work of national contact points. Actually today, the coordinators of national contact points meet in Brussels to discuss how to enhance the cooperation between them. So there is a network, but how we can even improve the work among the NCPs. And to exchange best practices on which information patients actually need and how they should be provided on a website, by phone, by answering to email requests or phones. As you know, the report has also identified major obstacles in the way the national law, the directive was transposed into national law. So we see highly elaborated systems of prioritization, unjustifiable low reimbursement tariffs, and also other major administrative requirements put on patients, like obligation to translate all documentation when asking for reimbursement. Commissioner Andriukaitis has discussed the outcomes with member states at the informal Health Council in September, and called on member states to eliminate these obstacles and to enhance the information given to their citizens on their right to cross-border healthcare. And while most member states acknowledge the content of the report is said, they felt generally it's a bit too early to make an assessment on whether or not this piece of legislation has been successfully transposed. In a way, it's true that, I mean, since many member states were late in transposing, so it was in the year of the 2014, and the report based on year of 2014 data mainly. We also made a evaluative study in Eurobarometer, so we talk about, I mean, 1.5 year of existence or entry into force of this piece of legislation still. So now for us, ensuring the correct and fair transposition is the next step in this long process. As I've said, we have already started this. At the moment, we are mostly in informal discussions with member states where we see problems in their legislation. And we can see even these informal talks lead some member states to move and to correct their legislation. We have already launched a first infringement case for compliance in September. And the Commission has clearly said he's ready to take any appropriate action, so more infringement cases when necessary. The next report we will have in 3 years' time. So the next 1 or 2 years is, I mean, by law, is dedicated to do the compliance check. So really verifying each provision, each notified measure, plus getting in talks with member states and prepare infringements when necessary. I mean, having this first implementation report, which indicates already where the problems are, and as I said, which we have already identified during the transposition time, I would invite the Parliament, I mean, to take it as a reference and to push member states, I mean, their own governments to do more. Because, I mean, there is, I think, a limit what the Commission can do. We really take it serious in terms of legal actions, but clearly a need of stakeholders, and I see, I mean, members then from our side as stakeholders to push their own governments to do more. So thank you.
Thank you so much for the information, and I know that the Commissioner is very actively involved to guarantee the implementation of the new directive on cross-border health. And it's interesting because we are always speaking about new directive, but it's not new because it was approved some years ago, and we are still discussing about how to implement. And we were discussing about that maybe the governments didn't realize the effects when they voted. And this is a good thing, because if they realized that time, maybe they didn't vote. And for sure, every time each real great innovation was made by the people that were not aware about what they were voting that time. So for this is important to create this collaboration, and I would like to underline what Annika was saying before, how to the European Parliament can help pushing the states to guarantee the effectiveness of the rights at the national level, because it's a big point right now. So we'll work together for sure, and thanks again. And now the floor to Alceste Santuai, Professor of the European Association of Health Law.
Thank you. Good morning to you all. Many thanks for inviting me to take part in this important event. I'm really happy that we heard some very important words by Annika, if I can say so, because some of my part of my speech was actually on the role of Commission, so I'm going to skip it because she has already said many things about that. I was in the steering committee 10 years ago that worked on the drafting of the first version of the directive, and I would like to underline the first version, where prior authorization was not there. Unfortunately, in the last version, prior authorization came back again into the text of the directive. I would like to draw on a recent article written with my colleagues from the Netherlands and Croatia, which was published in the European Law Review, titled 1 Year After the EU Patient Mobility Directive, a three-country analysis. And I would like to remind myself and all of you of some of the aspects which I reckon are important to to be stressed concerning the directive number 24 approved, as Antonio said, 4 years ago in 2011. We have to remember that by submitting the cross-border care directive, the Commission hoped to regain control over an area until then dominated by the judiciary, by the European Court of Justice and the national courts. Although I think that to some extent the European Court of Justice could be called upon again, but it has to be seen. And this will depend very much on how the member states will act in this direction, as Annika has just told us. And we have also to remember that sometimes we take it for granted, because one of the two questions was how do we make sure that the directive is rightly and correctly implemented at the national level. We have to remember that according to our European, let's say, legal framework, single member states have been free to decide within a wide scope how to implement the directive at the national level. And also that they remain solely responsible for providing safe, high quality, efficient and adequate healthcare to citizens in their relevant territories. Mind you that, just to mention an example, being an Italian, I would like to give the example about Italy. We have to remember that the implementation of the directive, unfortunately, probably they skipped or they did not attend the meetings with Annika, because the implementation of the directive in Italy is not only burdensome, but is really against the directive, okay? And I'll pick up this topic in a few minutes. Because prior authorization on one side and reimbursement of cross-border healthcare on the other part, are not really there to enhance patients' mobility. Rather, they're there to hinder to make an obstacle to patients deciding or seeking for a health treatment abroad. Unfortunately, the issue of prior authorization, if I may say so, it's really a big issue, because it has to do both with the national legal system and the directive. And in this regard, I would like to remember that individuals, and I would say also patient organizations, may even consider a more innovative approach, as we stated in this article, by challenging the incorrect implementation under the EU Charter of Fundamental Rights. We have Section 35, the right to health care, to be used, joined with the non-discrimination provision based on nationality before the national court, not to say before the European Court of Justice. Having said so, I think that the report that Annika mentioned, released in September 2015, concerning prior authorization, actually stressed that extensive systems of prior authorization should not be accepted or justified. I think this statement is already something which is very important to take into consideration. And so, in the end, I would conclude by saying that overall, the implementation of this directive should allow the overcoming of a purely economic approach to health services, so as to reach out for a new relationship between citizens and welfare states, which is actually challenged at the moment, as other people before me have already stated. This relationship is to depict enforceable rights also within the legal framework of patient mobility. Cross-border healthcare is expected then to strike a balance between the fulfilling of citizens' needs and the obligation of member states to ensure financial sustainability of the budgets of their national health systems. I would like you to refer to the Petro case, ruled by the European Court of Justice last year. Such a goal cannot be accomplished when member states build up barriers against the freedom of movement, thus preventing European citizens from migrating out of their health systems, not to talk about the possibility of being treated in their own national health systems. Hence, it is not a question of market freedom versus European social market. It is rather a question of implementing procedures aimed at supporting cross-border healthcare services, which could actually bring in important changes in the organization and management of national health systems. And I would like to, if I can say so, offer, or anyway to say that our association, which is the European Association of Health Lawyers, is available to, any kind of support, bringing in, legal expertise and legal experience in this field. Thank you for your attention.
Thank you very much, Alceste, also because we have to never forget that I would like to say that we can use the European Court of Justice to enlarge the rights, and we have several cases in the past in different legislations that how important has been the European Court to guarantee a wider range in terms of interpretation of the rights for the European citizens. And yes, it's important to underline this. So between the first and second part of our discussion, I'd like to ask to Mariano to put on the table some of the points of the platform of ACN in terms of proposals to actions for and debates for interest group. And just after this, we'll start immediately with the second part of the contribution of the stakeholders. So at the end of this part, we will have the discussion with all the participants, with comments and questions.
Thanks, Antonio. Thanks all for your contribution. In general, we believe that the directive has a quite positive structure, even if we well know current concern. Among the others, the transposition process has been slow and almost in the dark. The involvement of citizens' organizations is yet to be considered a priority. The information to patients is currently lacking, as you know. Also, the cooperation among national contact points is still largely lacking. At the same time, we are aware about what is still missing, and so from our perspective, what should be done. For example, accessible and comparable information among healthcare structures and among countries. The first issue is linked to the information on quality and safety. This information should be accessible and comparable for each health services inside each country and among countries. The second issue is linked to the needs to better know the impact of the directive. Data collection should be improved. Unfortunately, harmonization, standardization of data is far from being realized, in fact, to date, as you know. In the report written by the European Commission, only 17 of the 21 member states who introduced a system of prior authorization were able to supply data on application for authorization to the European Commission. A total of more than 100,000 requests were recorded last year. 5 member states have fewer than 100 requests for information. Portugal, for example, just 6. 3 member states, Germany, Finland, Austria, collected 75% of these requests. Probably they have used the website visit as a recorded as information request. We believe that it is very important to integrate different European policies. For example, if we consider the cross-border dispute and the rules on mediation, alternative dispute resolution promoted in several countries in several sectors by the European Commission, we feel that this option should be strengthened or introduced in the framework of cross-border. Second point, to integrate the principles of the cross-border directive in the context of the European mobility, as on the other hand, the means of transportation should be much more adapted friendly for the needs for who travels, not for business pleasure, but for healthcare reasons. 2 concrete proposals. We are interested to work toward the creation an APC net on cross-border healthcare, starting from the experience of the European Consumer Center Network, ACC Net, a network supported by the European Commission with the direct involvement of consumer organizations for the management of cross-border disputes in the consumer policy. we are interested to integrate it or to build an European patient-centered network in order to improve the citizens' protection in the framework of cross-border issues with the direct involvement of patient organizations. The second point is that next May, in occasion of the 10th anniversary of the European Pension Rights Day, it will start in 15 countries a communication campaign called Patient Rights Have No Borders, promoted by my organizations. The European Commission produced a document, a leaflet on patient rights in cross-border healthcare in several languages. We felt that this information should be complemented with the contact details of patients or healthcare user organizations in each country, as well as the contact of the national contact point, and why not also with some information related the rare disease, and so the European reference networks. The main objective is that patients can contact a local organization in case they need advice or support during their stay abroad. Moreover, it would be beneficial to patient organizations themselves, since they would be in a position to contact their counterpart in another country to get specific information on the local healthcare system, with a focus on the implementation of patient rights to answer the questions citizens ask them. And of course, this association can also be in touch with the national contact point as written in the directive. So these are very pragmatic examples in which way we can together work. Thanks.
Thanks, Mariano. I'd like to give immediately the possibility to start with the second part. The second part is patients' rights in stakeholder perspective. So we are speaking in the first part of the morning about the awareness, the empowerment, and so on. But now we are also discussing that a relevant part of this empowerment is not yet reached by the citizens at the European level, as well as in the several countries. And so many stakeholders speaking about how is important the patient centricity, but at the end of the day, often is not on the agenda to guarantee what patient centricity means daily in terms of rights and guarantees by in particular the countries about implementation of the rights. And so I'm very happy now to give the floor to Elena Gentile, member of the European Parliament, member of the ENV committee, one of the most relevant experienced women of the S&D party that since the beginning has supported our work, but also is important her contribution because in the recent past was also Commissioner for Health, is an important region in Italy, the Regione Puglia. So it's very important from our point of view, know also her own experience, both like member of the European Parliament on rights, as well as leader at regional and local level about implementation of rights for healthcare. Thanks to Elena Gentile.
Thank you and good morning, everyone. I think this is a very important opportunity to shine a light on the most recent steps that have been made on this topic. It's a very complex topic, and we're looking at the democracy in access to healthcare. This is a politically important mix of rights and healthcare welfare systems. And this is all very important in defining a free, accessible, guaranteed healthcare system for European patients. Recently, I have been looking at a series of incidents that have occurred in my country, which have impacted on patients' ability to access and to buy drugs, pharmaceutical drugs, over the internet. there's no barriers, there's no kind of support for information on the use of these drugs. Free trade of pharmaceutical kits, and these kits are often used not what they're necessarily supposed to be. They are used to make use of the side effects, and this is quite worrying and something that we really need to pay close attention to. These pharmaceutical kits, for example, can lead to miscarriage or abortion in young women, and I think this is something that we need to pay very close attention to. I think we need to make sure that we're heading in the right direction on this. The directive wasn't accepted for a series of reasons. I think referring to my country, it was because of concerns surrounding the cost of free access to cross-border care, not because the choices themselves or because people don't agree with choice. I think this is quite legitimate, particularly given the European backdrop to this. People should have free access to care. There was also a particular concern about sick people, about patients. So I think we need a lot of political scrutiny of how this is implemented to ensure that there are support networks and the correct type of assistance. We have to reassure patients and their families. Objectively speaking, the situation is already complicated, and it's made even more complicated because there's a whole series of barriers which act as a deterrent to accessing cross-border care. We need to ensure that we have participation from people who can really guide member states' choices to ensure that there is true democracy and full participation. We also need to look at how the directive is going to be implemented. We need to identify the most important, most critical points in the directive, but without forgetting the need to simplify procedures in order to make them more accessible. As I've said, the issue of cost is one which is of great concern in this initiative and is the focus of a great deal of attention. Public expenditure is subject to huge cuts at the moment, and that includes expenditure on healthcare. And this is this does not support the idea of free access to healthcare. Expenditure on healthcare shouldn't be seen as a cost, it should be seen as an investment. We have to encourage to drive investment in this and see it as a motor, as a lever for growth in Europe. If we want to see sustainable economic growth in the European Union, we need to also see an increase in well-being in healthcare. The directive needs to be freed from some binding tools which are being used by some member states to limit the full rights. there are such a huge, rich number of skills and backgrounds and experiences around this table, and I think we need to work on this topic based on the fact that our main priority should be to simplify. Because if we can't achieve simplification, then this excuse of the cost is going to undermine this initiative. And I'd like to thank you for listening. Of course, I'm here for any questions you may have.
Thanks to Elena Gentili also for the concrete tools and contribution to discuss about how to go beyond some excuses to not guarantee the concrete implementation of what has been decided 5 years ago. And thanks again, and immediately continuing to about the discussion about the key stakeholders to be part of this common process, I'd like to give the floor to Birgit Beger, Secretary General of the Standing Committee of European Doctors. So thanks for being here.
Thank you very much. Good morning. I can still say that. It's a great pleasure to be here, and thank you for the invitation. For many years, I had the chance to accompany your annual event, the European Patient Rights Days, and to see this initiative go a step further. This is very nice to watch. Thank you very much. We've been following the development of the Cross-Border Healthcare Directive very closely from its infancy, as to say, until its final adoption. And now it's the interesting period of the implementation, of course. And throughout this process, we took a patient-centric approach following the CPME's belief that main stakeholders from a cross-border healthcare perspective are patients, so wishing to use healthcare services abroad for various reasons. But as we've heard before, it is not out of pleasure and a fun thing to do. Many patients leave the country because they need the care, not that they want to leave their carers and their family, but because there is a medical need to do so. And this should be facilitated through the directive. So overall, we have it from the law professor concluded, and also from Annika, that there was a legal framework with the judiciary, what was cases all very patchy, and the directive was a step to really bring together in one piece of legislation the rights of the patient. So it is an important piece of legislation. Apart from that, there are also other issues, of course, e-health and health technology assessments, and also possibilities for patients affected by rare diseases. But maybe that is also the problem of this legislation, that is quite ambitious, that it puts a lot patients' rights, but also other instruments that makes it maybe more difficult to digest. But it's a rich source of legal text, and as we see, the member states will be surprised what else will come out of it in the future. As has shown the Commission's implementation report from September, there's still a poor level of awareness of European citizens as of their rights as patients in cross-border care. And I've just talked to my British member from the BMA who said that they have had discussions with their patients, and it's indeed true that many patients are not aware what is actually provided by the directive, and what could be facilitated much better if there were the tools at hand. So from the medical professions perspective, we see it is important to have the patient's trust, and that means also in these procedures, and that the rights are maintained, and confidentiality of the rights of patients is also protected. That is, for us, the trust and the confidentiality is a very important issue, because it goes hand in hand. Without confidentiality, there's no trust, and without no trust of the patient in the doctor's treatment and therapies, recommendations, there will not be good health outcomes. So this is very decisive. In this respect, we are looking also what doctors need to do in the future to be closer to the patient, to have better communication tools. We have a conference on the 18th of December in Luxembourg on continuous professional development of doctors, and I'm glad that patient representatives will be speaking there to give their views on the future of the professional development. Then one of the questions I was asked to answer was future topics for the interest group. I have already raised it a little bit, the confidentiality. I see e-health and big data are issues where we are a bit worried. It has a lot of potential, of course, e-health tools, but on the other hand side, there's still a lot of problems to be resolved, and I think the Cross-Border Healthcare Directive tries to do something of it, to bring the e-health network, the member states, together more closely, to have interoperability. We have the issue of electronic health records, so that a patient can actually travel across Europe and he receives the care which follows out of a good, concise record, but we need to establish this data and the interoperability and the safety as well. So this is I think an important topic for the group to think about how to have this e-health to support the provision of care. Rare diseases also rely on electronic tools because the experts are sitting in different countries, so it is important that the electronic flow is working, is interoperable. One topic maybe also to look at, we've been thinking about is that there are gender differences in healthcare. So we have been looking into forming a group within our organization and on sex and gender in medicine, with the aim to adopt a policy on the matter. Because we've seen it already with the clinical trials on children and women, they are often left out because they are difficult. You can't do clinical trials easily on children. You can't do clinical trials easily on women because they are pregnant or might be pregnant. So that sex differences, biological differences, and gender aspects, social, cultural determinants, behavioral norms, they have different influences on the disease in women and men. And this clinical research and public health policies do not sufficiently take into account these determinants. So we see it also in cardiovascular treatments. Women are often underrepresented, and evidence is mainly obtained from the trials conducted on male population. So this results in uncertainty in the management of cardiovascular diseases in women, and we also have not enough data for treating children. So this is something I think the group might also want to look along. And maybe just for concluding, never to forget, Elena already mentioned it, and I can fully understand it, that health needs to be in all policies, and health needs to be considered as an investment. If states and member states invest in a healthy population, this will, in the end, also have an impact on a healthy workforce and on the GDP. So early intervention and prevention are important tools, and I think that should not be forgotten. Also, if this cost argument is raised with the Cross-Border Healthcare Directive, patients going to have different treatments. But in the end, I think a timely and early intervention and good prevention is very useful in the long run and will only help to stabilize healthcare systems. Thank you very much for your attention.
Thanks, Birgit, for your continued support and also for the contribution to write together the agenda of the interest group, because it's absolutely crucial that the statement as well as the agenda and the future steps will build up together. And I give immediately the floor to Paul Delev, Secretary General of the European Federation of Nurses Associations, that is another key partner that we are implementing together different common actions, also using in the statements and the charters of the nurses the key rule of the patient's rights. So thanks again.
Molto grazie Antonio and Mariano, and there my Italian stops. But anyway, molto grazie per tutti. I wanted to say that also the first panel was more the legal talk. You know, we are very good in Brussels in legal talk, but I want to remind the MEPs that you are going back home to your constituency weeks, and for me this is important. it's very important you listen to the people who voted for you and who explain their concerns. I am not convinced at all that they will talk the legal talk. They don't talk the legal talk. So we need to be careful that we don't make the system over complex. And I follow already several years infringement procedures for other directives. We have a directive on mutual recognition of professional qualifications, which have been discussed for many years here in this house, and I hope I don't have to do it more. But anyway, I experienced infringement procedures on this directive with member states. Now, my reaction, daily reaction is the Commission sends a letter, the Prime Minister gets nervous immediately, and the health minister or the minister responsible gets immediately something done. That is the reality. Now, if civil society is not ready, because what do? Immediately the phone. That's what they do. How can we solve this? And of course, coordinators need to meet and blah, blah, blah. But this is not what it is about. It is about, because compliance meets transposition into national legislation. That does not mean that in practice it's working out. I mean, on the directive on mutual recognition, the governments put the directive into the national nursing legislation. Does that mean that every school in the EU delivers the nurses like they are written in the directive? No. So there is a difference between implementation and transposition into EU law. And this is quite important for EU accession. Please don't forget EU accession. Anyway, I fully support Mrs. Gentili, and I think your family name is very beautiful, I think. I fully support what you said, because we are very good in making things very, very complex. And I think we need to demedicalize the whole debate. Because if I have cancer tomorrow and my 2 breasts are amputated and I cannot get that therapy as quickly as possible, I will take my saving and I go. And I take on a stick my information, what they said about me. And I go wherever in the world I want to go. Now, this is only on the condition if you have this. Only this. Or support. So that's why I strongly believe that the active citizenship plays such an important role. In that sense that when we launched this together with you, what was important for me to see that when somebody of the panel asked, who is patient organization here in this room? 85% raised up their hands. And this is a gold mine you have. This is a gold mine you have because many organizations have civil servants sitting around, but not patients. And you need to strengthen the voice of your members. And if we can link the voice of your members, imagine your Italian members, they need to talk to the Italian nurses. There are 750,000 Italian nurses. There are 750,000 UK nurses. They have a say in this, and it's not a problem for me for confidentiality and trust. If you do a barometer, whatever barometer, citizens trust nurses. I have no doubt about this. So we need to make sure that information going in simple words. We are very good in explaining how difficult everything is. But if you have something tomorrow, your mind is lost. You need somebody who speaks to you in a simple language, easy to understand, and to help you making the best decision. And you will go to sleep and you will say, will this be the best decision? And you will ask another one. And if that nurse is your neighbor, a citizen, 3 million citizens are nurses. It is okay. Ask them. So my plea is a little bit, please don't make things too complicated. And the problem with infringement procedures is this costs a lot of money. Huh? Who is going to pay this bill if the government doesn't comply? So somebody will need to pay millions of euros. Who is going to pay this final bill? So try to work in another way to make sure that people benefit, and I fully underline your two proposals on that. Also make sure that on data collection, I'm already data collecting over 30 years, and still we are discussing in the OECD and Eurostat the problem of comparability. So don't think that the data will tell you the right story either. So I mean, don't only invest in that. Put your eggs in different corners. But I strongly believe that on prevention, ASEAN and EFN has worked together on an EU guideline on prevention on e-health services. E-health services for us work perfectly in Birgit. And we are not waiting until the confidentiality and the interoperability problem is solved. We are moving forward. So in that sense, this check-off of prevention is done. And there are different ways. You need to put flesh on the bones of this document by practical things. I invite you to read all the Horizon 2020 proposals on the table. Come and talk to me where you want to be a partner. Because for implementing this, a lot is on call. And the first one is the right on innovation. We have the right in the healthcare sector to think differently. And I call up the physicians again to try to think differently, to see how the healthcare system can be differently in the coming years to go. This is key. Otherwise, Mr. Gentili, the system will not be sustainable. It will not be sustainable. So we will need to put more efforts to do things differently, but better. And I think the nurses, the 3 million nurses in the EU and the 13 million nurses at global level, we are ready for this journey. Don't worry. And we are willing to take the lead. Don't worry. So I really hope out that the ACN takes this work further and fully support in the access debate, fully support in the data debate. Don't do too much. Don't do what I want you to do. Do what you want to do. But you get our support.
Thank you so much, Paul. And the word to Paolo Giordano, Secretary General of the European Union of Private Hospitals.
Yes, good morning, everybody. Thank you for inviting me. It's a while we are cooperating with you, Mr. Botta, on many health issues, like we signed together the European Charter of Patients' Rights. Of course, our association is following this directive since the beginnings, and as it was told this morning in the previous meeting, there were different versions of this directive proposed by the European Commission. The point is that these versions were spoiled because we had a problem with member states to accept this directive. We discussed it about this directive, I think, since the Bolkestein directive. So, in order that all member states could accept this directive, the text that came out is quite light. In this kind of text, we have a big problem, I think, for patients, a big problem with information. The information is the key word. The patients need to be informed about accessibility, delays, quality, and cost. All the information that should be given to patients is in the hands of national info points, which are not working at all in a properly way. You can just take any member states, for an example. You take France. What is the info point in France? is inside the Minister of France, the internet site. You have a specific session with info point cross-border directive. So the patient even do not know that this directive is existing in France. If he doesn't go in the Minister of Health in France, he doesn't know of the existence of this directive. In Italy, there is a specific info point. However, if you go through, you see that abroad there are only listed like 10 public hospitals and 5 private for each country abroad. So there's really, really a big lack of information. Also, not only to patients, but it's important that also all, I think, the professional health force should be informed about the possibility of this directive. I think that hospitals have to be listed properly. And then talking about the prior authorization, these last years, some treatments changed due to the technology development. Treatments that were done under hospitalization, like for instance the knee prosthesis, nowadays in most developed countries are treated under ambulatory care. So you don't need any more to be hospitalized. In one day you make a hip prosthesis or knee prosthesis. And the patients, again, do not know these possibilities. I think that info points should publish their data, their results. And so I propose to this intergroup maybe to start to collect data of all national info points in order to really evaluate the good implication of member states, and maybe also website to inform patients should not have only to be treated by member states, but maybe by the European Commission and all the institutions together. This is the point of view of my association.
Thank you very much, Paolo. And I would like to ask to Giovanna Marsico, Director of Cancer Contribution, absolutely key, important platform on cancer from France, to give us her comment. Please, Giovanna.
Okay, thank you very much. Thank you for inviting me here and to give me the opportunity to bring the voice of patients as a patient representative. I had prepared something in English, but I think that I will faster and more synthetic in Italian. I would have liked to speak in French in order to honor this country, which is so touched in this moment, but there's no traduction. So I keep on in Italian. Allora, nella continuità dei miei predecessori.
Well, just to link up to what previous speakers have stated, I'd like to take a few key terms, and that's democracy. In France, I am at the head of an association for healthcare users and patients. It is an association that is a part of health democracy. Health democracy is a concept that was developed in France. It has a legal framework that applies to it. In 2002, it was passed through the Kouchner Law. So this was a law that really did recognize the patients, not just citizens, but patients. So people who have a specific illness. It gives them individual rights, community rights, collective rights. So the individual rights, for example, include the right to information, right to medical records, to be able to fight injustice. And there are damages that apply to this. It requires the users of hospitals and healthcare structures to actually find a way to make sure that there are patient representatives involved in all decisions that are going to be made in terms of what type of a healthcare policy is going to be implemented. So all of this is very good. The law was passed 13 years back. Nonetheless, we do have some questions that still exist as to the implementation of the law. To just perhaps go back to something that Dr. Giordano stated, when it comes to information on the directive, if you go to Cancer Contribution, the website in France, you will find this information available with the limits that apply to what visibility we can give to that. Today I would like to share with you a few categories of information where patients those individuals who are sick or not are actually curious and interested in the directive and the European approach to this subject, the subject of healthcare, of course. Now, the first point is information and education. Information has been brought up on more than one occasion this morning. Information is not something that means that you would just have access to data or a bit of information. Information really means that you would understand the information that is available to be able to take informed decisions on your health. So this should be accessible and given to patients in layman's terms. So that was stated by the person who took the floor just previous to me. Now, this should mean that the person can make an informed decision, can make a choice. Now, this is a number of different conditions that come together that don't necessarily always exist. Usually there are brochures, there are websites that give that information. The problem is that the information is only available to a certain part of the population, and there are inequalities that exist within European peoples. So there are some that are more vulnerable, some that are more fragile in terms of their access to information. So we still see that there is a lot of inequality that exists in this area. Some have the ability to make decisions because they received the pamphlet that would allow them to understand, and others did not. So that is why we believe it's so important to address this issue of education on the healthcare system, so that they can find their way around their healthcare system, and so they can also assess what they need to be able to do. I don't think we have discussed their ability to assess yet. How can we involve citizens? Cittadinanza Attiva is doing this wonderfully well in Italy, so how are we able to involve citizens so that they can make decisions as to their situation? So in France, it's still something that is a work in progress. So for patients and for associations that represent them, this is still a challenge. The sustainability of these organizations are also a challenge. And making them professional is something that is still ongoing. And then there is the involvement of doctors, nurses, healthcare professionals. Nurses are usually closer in contact to the patients, so we need to continue to educate them as well. They need to be informed on how they can inform. How can they inform patients so that they can allow them to make choices? Clinically, there's a model that exists, the shared decision making. This is a model that can be used clinically, but not only. It can be used for the purposes of making large-scale decisions as well. Another issue of great importance that I did want to discuss with you this morning, and it was touched on earlier, and it was turned as to outpatient care. We're trying to move towards more outpatient care in cancer and specifically. So there are oral chemotherapy methods now that are being used. This is something that is making great strides, can be extremely important in terms of reducing costs. It also can improve life quality of patients. But there are two caveats. The first is that you need supported care at all times. You cannot leave a patient alone in their home to take care of themselves. They need to be assisted, so supported care at home is something of great importance, and I think that we still have much progress to make in this area. We should be reflecting on this. The second thing is that there's the cost issue, of course. These types of care must be accessible to all throughout Europe and not just in some given member states. when it comes to the economic issues, the cost of treatment and care, the frightening uptick in cost, and the response of member states in the negotiation, and my colleague who's here to my side knows exactly what I'm speaking about when I say that I think that we need pharmaceutical companies to make a huge effort here so that we can find new models to try to avoid this ridiculous increase in drug costs. Clearly, that increase in price will mean that people will not have access to the care that they need. In conclusion, and I made reference to this previously, we need to find the best way to involve patients in understanding and assessing bills and laws that exist, i.e. directives, the one that we've been discussing this morning, for example, and also their ability to assess the healthcare system as a whole. Citizens cannot, of course, go abroad and receive care if they don't know that the care exists and that that care has been tried out by their peers. So putative peers that could perhaps share with them the information that this is safe care and that they can use it and that they should have dignity of care. So on that note, I should like to conclude and thank you.
Grazie Giovanna.
Thank you
for your contribution, also because it was touching in particular the involvement of the citizens, not only as people to hear and then you decide in your own way, but also to involve them also as evaluator of the standard of the healthcare system. So thank you very much. And now, please, it's free. Say your name and the institution that you come from, and first intervention, please.
Thank you very much. I want to introduce myself. I am from S&D Group MEP. I am here because I am shadow rapporteur on the data protection regulation. And that's why I suppose that my contribution could be of some interest, because we are in the final stage. We end before Christmas our work on new regulation. And it will be then discussed and passed, I suppose, in the beginning of next year. What does it mean? It means that in this regulation will be directly implemented, as you know. There is a very big attention to the healthcare. And we have had a lot of contacts with the patient organizations, with the doctors' organizations, with medical researchers to make this part of this regulation well-fitting to the needs as patients, but also of the medical research and so on. And I have no time now to give long speech or more information, but I want to assure you that we are very much interested in cooperation, in discussion of that regulation. When we speak about the cross-border healthcare, then their exchange of information, the rights of patients to have their information, portability of information, but also the protection of the patient's privacy of the major importance. And also, as here are the patient organizations, I maybe want to say one thing. As you mentioned here, trust and confidentiality is a basic part of the medical service. But unfortunately, also, we know that there are data breaches, there are problems. And in this new regulation, there is a special provision about the right to all kind of redress and so on, but also right of organizations representing patients to take care, to represent, to help, to fight for the rights, but only if in the statute of this organization this moment is mentioned, so that there is in statute this right to represent the patients in the cases of information breach. So what I want to say just now to you, in order that you check your statutes, that this right will be there. But what about all those details, and especially connected with e-health? then I suppose that maybe if you have planning or you're planning your next activities, it could be a very important issue really to have discussion on that. Thank you very much.
Thank you very much. It's very, very interesting, and also to underline as it's important to collect point of view also on new legislations that are on the way, and also underlying the e-health point is absolutely key for the next steps of our work. And other contributions, comments, questions? Who will be broken the ice? Any volunteer? Oh, please, come.
Hello, my name is Thomas Kangatuna. I work for Burson Marsteller in Brussels. I pretty much actually welcome the creation of this MEP interest group, and I wish you well, of course. And I would like actually to know if there is any already sort of intentions or plans to also collaborate with other MEP interest groups active on health issues. I'm thinking about the MEP groups on patient access, for instance, the MEP groups also on maybe on more sort of specific diseases. You have MEP groups on cancer or on other chronic diseases, which of course are also treated in different manners in different member states. And as you know, one of the big things and one of the big intentions or sort of deliverables of the directive, I think at the time that it was adopted, was also to sort of also improve the way of the comparability of healthcare systems, and maybe more collaboration between MEP groups could also help move things forwards in this respect.
Before to give answer, that I think that could be yes, and it must be yes, and also because merging the energies is only way to try to change the things around, and in particular on this issue. And other, please.
Thank you and good morning. I'm Paul Laffin from the British Medical Association, a colleague of Birgit's from the Standing Committee of European Doctors. We represent the medical profession in the UK, working in Brussels. In essence, it's a comment as opposed to a question, and it's to back up the comment from our Commission friends here that it's for national governments to do things as opposed to the European Commission. Now, a recent European Commission survey indicated that in the UK, only 6% of patients knew what the directive was. Now, that was incredibly low. I think top of the table was Malta at 24, not particularly high, but much higher than the UK's. So the BMA consulted amongst its own patients. We have a patient liaison group to see whether that 6% figure was accurate. Was it high? Was it low? And the answer I'm about to give you probably won't come as a surprise. Out of several hundred patients across the UK who we contacted, not one single patient had heard of the European Cross-Border Healthcare Directive. Now, why that is, we all have our explanations or reasons, but working quite closely with the UK government on this for the last couple of years, they have a policy of signposting information. Now, that's a bit of a euphemism for those of us who speak English as a native language. Signposting is essentially, we'll put it out there and then do nothing about it. So in essence, it's not for the European Commission to do more. It's done, from what we can see, everything that it can. It's up to us as national medical associations, patient groups, to pressurise our respective national governments, and my own is probably the worst offender, to do more than signpost and actually tell patients and physicians that the directive exists, that is out there, and how it functions. Thank you.
You're welcome. Comments, questions, please.
Sono Alberto De Santis, presidente.
I'm Alberto De Santis. Recently, my organisation came to the European Parliament and presented the platform for pain. We know that there are various groups and associations who deal with pain. I'd like to thank David Borelli. He's worked with me on this. also Gianni Patella has as well. What we're trying to do together with MEPs is to organise ourselves into one single group that would look at the issue of pain. Because chronic pain has become a very serious issue. In Italy, we've carried out some kind of screening, some kind of inquiry, and the results we've got are really excellent. We're doing more work on this, and we'd like to see the same methods used throughout Europe. With our scientific manager and the president of the organisation, we've moved to Portugal and to Spain, and we'd like to try to work with the UK as well to try to have a standardised evaluation grid so that we all know that what we're talking about, that there's a single set of criteria for that. At the moment, the problem is to identify certain characteristics or objectives. I would like to entrust Mr. David Borelli with the organisation of this group. It has to be done at political level, but also bringing together the different organisations and associations who work on it. If we work separately, we're just wasting overlapping energy. Whereas if we work together, we can exchange information and we'll meet our objective much more quickly. Thank you very much.
Thank you. Other, please.
So it's Silvia Bottaro from the European Hospital and Healthcare Federation, and thank you very much for the meeting of today, which I think is very interesting, and I would like to share an information with you, because since 2012 we have been partner of a UCO-funded project called ONCAB, and the aim, one of the objectives of this project has been to create a pilot network of hospitals, really looking into sharing information and experiences on the topic of cross-border healthcare, and so this network is now composed of 16 hospitals from 7 member states, and we really try to share experiences and very practical issues like the reimbursement one, because sometimes patients come to the hospitals, but in the framework of the directive they need to pay upfront. Are they aware of this? And so, well, these pilot networks try to look into all these issues, and it will be great if we can share the results of this project in the next meetings, maybe of this group. Thank you.
Thank you very much. Please, Annette.
Annette Dumas, SDM Consulting. I've got one comment to make regarding the patients not being aware of this directive. I think it's because here we have been working on this directive. We are among people who are very knowledgeable about it. But if you go down to the ground level with any patient who is not involved in the same issues as we are, they don't know about it. So I guess there should be a role for patients' organizations to disseminate the information about this directive, and also to work more closely with the professionals, because the professionals will be aware of it through their trade unions, through their professional associations and things like that. So they already know about it, but they must link up with the patient organizations to make sure that the information is more scattered at ground level. That's my view.
Merci, Annette. Please.
I just wanted to add that in this parliament is an interest group on carers led by Marianne Harkinen from Ireland already many, many years. And I think that this is a group we really forget. And I really want to point out to the Italians here in this group, because if you have 3 million women in a profession and you're belonging to a family of 5 men, 5 brothers, and your mother gets dementia, they will ask the nurse to stay at home. They will ask to take the mother in-house and to care for that mother until she passes away. So nurses are giving up their profession, also their pension, at the end of the working career to help the families, but the men are continuing their career. So make sure that you link up. The patients' organizations and the groups are very important. but the people around these patients, the carers, are crucially important, and because they leave their job behind. They have no other choice. If you have a leukemia child tomorrow, it is the woman who stays at home, not the man. And we need to make sure that within these 15, 14 areas, the gender issues from a pragmatic perspective, not only a research perspective, but also from a daily working life perspective, is picked up more. And I'm picking up on Italy, because you are very good in this, how this society can make sure that women have a better place to move things forward. Thank you.
Thanks, Paul. Last comment or question? Okay. At this point, I give the floor to Mariano for the conclusions of the meeting.
Thanks, Antonio. I thank all for the input, very, very interesting, and I appreciate your comment. For example, just to answer your question, of course, we are interested to be in touch, to cooperate with other interest group. We have invited here today also some representative of the others, as well as the representative of other network and the stakeholder as the European network of the company, as well as others. So the message is, of course, we are open to cooperate with the others. Talking about the role of the member state, we are also interested to realize some meeting in several countries, because here we are not the point of view of the member state. I have appointed to simplify democratic access, practical tools to implement the directive. Of course, should be interesting to realize several meetings in order to approach each one of these issues in the next month. We are interested to send you not only the minutes of this meeting, but also an open call in order we can together reach the agenda of the next meeting of this interest group. Talking about the information, the role of the patient organization to inform the patients. We believe that we are involved on it. At the same time, I don't understand why, for example, talking about the national contact point, it's very difficult to understand which the responsible inside the national contact point in several countries. We don't find the name, the responsible, of course, the Ministry of Health. And then, this is important also to be in touch, to start a relationship, to know who is involved, who is responsible to manage the national contact point in several countries. As well as when the European Commission produce document, information, leaflet, etc., and then send this kind of information just to the representative office in the country without involve the patient organization, I ask if it's useful or not this way to widespread the information. The European Commission has many platforms of patient organization, but in a way they forget. Also in easy way in which we can help to widespread the information. Talking about the European the directive, but also other topic. So I want to thank you again for attendance to this meeting. I just want to remember that May 4th it will be the 10th edition of the European Pensionary Day. So it's very important. We will celebrate here inside the European Parliament. Of course, you will be invited. And for me, it's all. Thanks again. Have a good day.